I will begin disinfecting your room in 15 seconds. Please leave the room.
So the four bad pathogens that we included in our study were MRSA, vancomycin-resistant Enterococcus, Clostridium difficile, and multi-drug-resistant Acinetobacter. And these are the kind of the top four of bad bugs that we'll see in hospitals. When patients get infections from these organisms, they have prolonged hospital stays, often require intensive care, and have basically, a major interruption in their life because of the ill effects of these types of infections. There are several different interventions we use in the hospital to try and decrease the transmission from these pathogens. Hand hygiene is a big focus. We also use what we call contact precautions, where for patients that we know have these pathogens, we'll wear gowns and gloves and then discard those gowns and gloves when we're done caring for that patient, so we don't then carry that organism to the next patient. And more recently have really been focusing on the environment as a way to decrease the transmission. So in our study, we trialed 3 different enhanced strategies for cleaning rooms in the hospital. And what we found is that if we added a UVC emitting robot to our standard cleaning, then we could actually reduce the transmission and infection from these 4 bad pathogens by 30%, which was a significant finding from our study. So we're now in our hospital using standard chemicals for cleaning, but then once we're finished with our routine chemical clean, we'll roll in a UVC emitting robot, turn it on for approximately 30 minutes, and add some enhanced disinfection to the room before that next patient then comes into that room. We had 2 tertiary care centers, Duke and UNC, a VA, and 6 different community hospitals. So there was good representation of all of the different areas that care is provided. And we found that in general it was effective in all of those settings. And so I think it's important that we have pretty good generalizability from our study, and that we think that it's an effective strategy not only in the big hospitals like Duke, but in small community hospitals as well.